In this video, we'll discuss a class of drugs known as stimulants. So stimulants would be defined as drugs that increase excitement, alertness, motor activity, they elevate mood, they decrease fatigue, and that's some of the reasons why people take stimulant drugs is, maybe they feel tired and they want something to kind of pick them up. They need to be more alert. They want to elevate their mood. And maybe that's why people continue to take stimulant drugs, because they like the way they feel when they're more alert, they're not tired, they have this elevated mood. So the stimulant drugs that we're going to talk about are amphetamines and cocaine, which are kind of your classic stimulant drugs. We'll also talk about Ritalin and Adderall. MDMA is one of those drugs that could be classified in a couple of different ways, and so we're going to talk about it here as a stimulant drug, but then also as a hallucinogen, which is probably what it's more commonly thought of. And then we'll also talk about nicotine, which has some combinations of both stimulant drugs and other classifications. And this is where the classification of drugs can be tricky. There's different ways to classify them. And so talking about stimulants versus depressants, and hallucinogens, that's one of the common ways to classify drugs, but there are many different ways, and sometimes drugs can be categorized in more than one of these categories. So the question that we're going to look at in this video is really, how do these drugs work? How do stimulants work? So in the Robin Williams documentary, you got to see the behavioral effects of these drugs. So now we're going to talk about what's going on in the brain. So for amphetamine and cocaine, we know that they have a similar mechanism of action in the brain. And one way that they both work is by blocking the reuptake of the dopamine transporter. So again, that's very similar to what we saw with those antidepressants, right? This blocking the reuptake. And so we should remember from those videos that when we block the reuptake of the dopamine transporter, we're increasing dopamine in that synaptic cleft. Now, dopamine, we said, was the neurotransmitter most commonly tied to the reward system and drugs and addiction. So again, what is blocking the reuptake transporter going to do to dopamine levels? It's going to increase the dopamine levels because it stays in the synapse longer. Thus, it can have an effect on that postsynaptic neuron for a longer period of time. Now, for simplicity, I'm only going to hold you responsible for knowing that amphetamine and cocaine block the dopamine transporter and increase dopamine in this way. However, there is some research that is coming out that suggests that amphetamine also has some additional ways that it can have effects on the brain, which is perhaps why maybe it's a little bit more addictive and has different behavioral effects. It's suspected to be able to push dopamine out of the synapses so that it actually, because it resembles dopamine so much, that it causes the exocytosis of dopamine from that presynaptic terminal. Also, that in addition to just blocking the reuptake transporter, that it actually can stimulate that transporter to work in reverse, thus pumping more dopamine out into that synaptic cleft as well. So it has a higher potential of increasing the amounts of dopamine much more in the synaptic cleft than cocaine. And these drugs also will work in a similar manner on both serotonin and norepinephrine, but it is believed that the addictive effects and on the behavioral effects are really caused by the changes in dopamine levels. So that's what this is just trying to show you here, is that this is dopamine being released, and then dopamine goes into the dopamine transporter, and that transporter brings it back into the presynaptic cell where it can be put back into the synaptic vesicles. So it's just a three-dimensional, or attempt to have a three-dimensional rendering of that. Now here's what happens when amphetamine or cocaine comes along. It attaches to that dopamine transporter, and this dopamine can't get taken back up into the presynaptic cell. You can see here, this is mimicking cocaine, that now we have a lot more dopamine in that synaptic cleft. Compare here, normal circumstances, to here, where we have cocaine blocking that reuptake transporter. So what causes withdrawal symptoms? So once somebody stops using the drug, what causes those withdrawal symptoms? So one thing is that after a few hours, dopamine can be depleted. So if somebody is doing multiple lines of cocaine and that dopamine is not being recycled, it's constantly being pumped out into the presynaptic cell and not being allowed to come back in, eventually dopamine is going to be depleted. And this can result in reduced energy, motivation, mild depression. The list of emotional withdrawal symptoms could be anxiety, restlessness, irritability, insomnia, poor concentration. Physical symptoms might be sweating, racing heart, palpitations, difficult breathing. And a lot of this is because your body was used to so much dopamine and now it's gone. And so your body needs to try to adjust for that. So another stimulant that we're going to talk about is methylphenidate or Ritalin. Now this is another drug that may also sound familiar to you. Who takes Ritalin? Who is Ritalin often prescribed to? Individuals with ADD or ADHD. Now if you think about it, someone with ADD, they're taking Ritalin to help them focus, to increase their concentration, to help them maintain alertness. Now the question is how does Ritalin work? And surprisingly, it works in the same manner that cocaine and amphetamine works. It works by blocking the reuptake of dopamine. But if you think about it, someone who's taking Ritalin, again, they're taking that to maintain their focus, to be able to concentrate and do probably their schoolwork. Whereas someone who's taking cocaine, think about that in that video that you watched, the behavior, that grandiose type of behavior, that you can do anything. A very different type of behavioral effect. So why are the effects of Ritalin different than cocaine? If both of them are blocking the reuptake of the dopamine transporter, why are their behavioral effects so different? And if it's not obvious right off the bat to you, think about the method of delivery. So how does someone who takes cocaine or uses cocaine, how do they most commonly ingest that cocaine? It's typically a sniff through a rapid insufflation, sniffing it up their nose. And so when they take that cocaine and it goes up into those nasal passages, it goes immediately into the bloodstream and has a rapid effect. It goes right into the bloodstream, right up into the brain, and has a rapid effect. Now, how do most people take Ritalin? In a pill. So you take that pill, it goes down into your digestive tract, it has to pass through your stomach, some of it might slowly start to get absorbed into the bloodstream, then it goes into your intestines, and it slowly over time, that drug is getting absorbed into your bloodstream, and then it takes time for it to get up into the brain where it's going to have an effect. So it has a gradual effect over time. Now the question is can Ritalin be addictive? The answer is yes, if it's administered so that the effects are similar to cocaine. So how would you do that? You could take the Ritalin, you could grind it up, and you could also snort it. That would give you a very similar effect to cocaine. And unfortunately, it is something that is abused, and there's a black market for it in colleges. Not just to have it as a drug of abuse, but for students who feel fatigued to take this, to take Ritalin this way to help them maintain a certain level of achievement, perhaps. But keep in mind, it might sound like it's better than cocaine, but it's really still acting in the same manner, and it can be just as addictive. So another drug that is used to treat ADHD that you might be familiar with is Adderall. Now, Adderall is different than Ritalin in that it is actually a combination of amphetamine and dextroamphetamines. And while Ritalin is faster acting, Adderall actually stays in the body for a longer period of time. But because it's also a mixture of amphetamine, it's still working through blocking those dopamine transporters. Now, MDMA or ecstasy is one of those that can be classified in a few different places. So we'll talk about how it blocks the reuptake of serotonin in a subsequent video. But how it also acts as a stimulant is that it blocks the reuptake of dopamine. And you think about it, when people take MDMA, they have lots of energy. It's known as that club drug, right? So this is just showing you, again, how ecstasy works here, blocking the reuptake of dopamine. Some of the acute effects of dopamine: heightened perceptions, reduced appetite, stimulation, which is why we're talking about it here, elevated mood. Some adverse effects: clouded thinking, hypothermia, disturbed behavior, jaw clenching. And we'll talk more about some of the behavioral effects of MDMA in a subsequent video. So nicotine is another drug that can be classified as a stimulant. It is the active ingredient in tobacco, and where it kind of becomes a little fuzzy is that, yes, it can stimulate the central nervous system, but a lot of people use nicotine to relax. They're stressed out and they smoke a cigarette. So again, it's one of those drugs that can be classified in multiple places for a variety of different reasons. So nicotine actually stimulates the nicotinic receptor, and this nicotinic receptor is for our naturally occurring neurotransmitter, acetylcholine. Now, we have a lot of nicotinic receptors in the nucleus accumbens. So the idea is that the nicotine from the tobacco goes into the nucleus accumbens, it binds these receptors, and it releases dopamine. And so that is how nicotine becomes addictive, is that it enhances the reward system, just as some of these other drugs. Now, I should say here also that, we're talking about the dopamine and the reward system, and the text really goes through and tries to emphasize this dopamine reward system and connect all of these different addictive drugs to that system. Now, keep in mind, there are some other areas that have now been more recently associated with reward as well, including the cerebellum. So while this nucleus accumbens and dopamine system is something that's been around and talked about for a long time, as you go forward, there may be some other newer discoveries that might change the way we look at some of the ways these drugs work and cause addiction.